Welcome to Dr. Health Hub channel. Today, we're going to talk about a topic that many girls and women experience during most of their life. Have you ever faced painful periods? Yes, this condition is called dysmenorrhea, the medical term for menstrual cramps. It is one of the most common gynecological problems, and while many women accept it as a normal part of life, it's important to understand what it is, why it happens, and how it can be managed. Let's explore it together in a simple and helpful way. So, what exactly is dysmenorrhea? Dysmenorrhea means painful menstruation. It happens when women feel cramping pain in the lower abdomen before or during their period. The pain is usually strongest in the first 1 to 3 days of menstruation, when the uterine lining is being shed. For some women, the discomfort is mild and manageable, but for others, the pain can be severe enough to interfere with school, work, or daily activities. That's why it's more than just normal pain. It deserves attention and care. Why does this pain happen? The uterus contracts to help shed its lining during menstruation. These contractions are triggered by natural body chemicals. When the levels are higher, the contractions become stronger and more painful. This is the main cause of primary dysmenorrhea, which is not linked to any disease. But sometimes the pain is due to another condition. This is called secondary dysmenorrhea. It can result from endometriosis, where tissue similar to the uterine lining grows outside the uterus. It can also be caused by fibroids, pelvic infections, or ovarian cysts. Unlike primary dysmenorrhea, which often begins in teenage years, secondary dysmenorrhea usually develops later in life and can become worse with time. Risk factors include early age of first period, heavy or prolonged menstruation, stress, smoking, and family history of painful periods. And what can someone know it's dysmenorrhea and not another problem? The key symptom is cramping pain in the lower belly that occurs before or during menstruation. The pain can spread to the back, hips, or thighs. Some women also experience nausea, vomiting, diarrhea, headaches, or fatigue. Primary dysmenorrhea typically starts soon after a girl begins her periods, often in the teenage years. Secondary dysmenorrhea, on the other hand, may begin later and can be linked with other gynecological conditions. A warning sign is if pain suddenly becomes much worse than before, or if it happens at times not related to menstruation. In that case, it's important to see a doctor because another health condition could be the cause. And what can help with the pain? There are several options. Many women find relief with common pain relief methods that are safe and widely available. Using a heating pad or hot water bottle on the lower belly can relax muscles and ease discomfort. Light physical activity like walking, stretching, or yoga improves blood flow and reduces cramping. Relaxation, deep breathing, and proper sleep also make a difference. When self-care isn't enough, doctors may recommend treatments that regulate periods or reduce pain, such as hormonal therapies or other medical options. These must always be given under medical guidance, based on each woman's condition and safety. Can period pain be prevented? Yes, at least in part. Lifestyle habits play a big role. Regular exercise helps regulate hormones and reduce pain intensity. Eating a healthy, balanced diet with fruits, vegetables, whole grains, and omega-3 fatty acids supports reproductive health. Cutting down on smoking, alcohol, and caffeine may reduce cramps. Stress is another factor. Learning stress management techniques like meditation, deep breathing, or gentle stretching can help. And finally, routine medical checkups are important. If menstrual pain is severe, persistent, or getting worse, a doctor can check for conditions like endometriosis or fibroids and suggest the right treatment. So, painful periods are common, but they don't have to control your life.
Exactly. With self-care, healthy habits, and medical guidance when needed, most women can manage dysmenorrhea effectively. Period pain should not be ignored because better management can improve quality of life and daily productivity.
Thanks for watching Dr. Health Hub. Don't forget to like, share, and subscribe for more trusted health tips. Remember, your health is your wealth.